Hi everyone, this is Dr. Hall, and I'm recording the last part of the reproductive system lectures for extra credits. So birth control and STIs are really important topics, so I wanted to make sure you had access to this information. So we'll start off with birth control, which is formally called contraception, because conception is getting pregnant, and so contra is trying to prevent conception, so birth control. There are lots of different forms of birth control available with varying levels of effectiveness. So we'll talk about effectiveness as we go through the different methods, but I just like this graph because it kind of shows you at a glance which are the most effective methods. So first we're going to talk about hormonal contraception because it is one of the most popular and one of the most effective methods of birth control. So there are two different kind of flavors or variations or categories of hormonal contraception. One is what is called CHC or combined hormonal contraception. That means it has two hormones in it, both an estrogen and a progesterone. And just so you know, if you look at, the ingredients for birth control pills or something like that, it's not going to actually say estrogen and progesterone because we create synthetic versions of these in the lab. So it might say norgestrel or norethindrone. Those are synthetic versions of progesterones. So don't worry. They just have names that vary quite a bit depending on exactly what that molecule looks like, but they're all in that same family. So you can have a combined hormonal contraceptive with estrogen and progesterone in it, or a progesterone-only method. So for the combined hormonal contraceptives, they're going to do two things to prevent pregnancy. One, which seems to actually be the main mechanism of their action, is that they thicken the cervical mucus. So the cervix, that gateway from the vagina into the uterus, normally creates mucus that around the time of ovulation tends to get really thin and stringy and form little channels that sperm can swim up through. So you can see here in the diagram, they call it this S-type mucus. That's what normally forms around the time of ovulation. It's like saying, this way, sperm, come this way. But what someone on birth control will have is this different type of mucus where the molecules are all aligned in a way that it just forms a wall and the sperm can't get through. So that's pretty cool. The other thing that it does is, of course, you're taking hormones in from outside your body, exogenous hormones. And so your hypothalamus takes a look and says, oh, there's plenty of estrogen around. I don't need to tell the girls downstairs to make any. So your hypothalamus will not produce GnRH, and the pituitary gland will not produce LH and FSH, and therefore the ovaries themselves will not make estrogen and will not mature follicles and oocytes. So that's that negative feedback. And in ye olden days, when birth control pills were pretty high in their doses, this was definitely how they worked. Nowadays, this is a minor mechanism of action, a minor way in which birth control works, and some forms of pills and other methods currently available today aren't a high enough dose to do this, but that's okay because they're changing the cervical mucus and the sperm can't get through anyhow. So I found this, I thought it was really cute, right? So how the pill, which is a combined hormonal contraceptive, works. And so not on the left, right? It's not like it just is a killing field for sperm, right? But on the right, you can see you've got these sperm that can't get through the cervix because the mucus is changed in consistency and is keeping them out. And then we have the little egg sitting in the ovary saying it's not going to be released, right? They're not going to ovulate because they've got that negative feedback. Now, the guy in the middle, the where do I go? There's some theory that maybe it makes it harder for sperm to know which direction to swim in. That's not as well backed up, so we don't know. All right, so the thing about CHCs is there's lots of different ways to get them into your body. Kind of the first way that was ever invented is to take a pill, right? So this is kind of the classic way to get this hormone into your body, is to take it orally as a pill. You take them once a day, every single day at approximately the same time of day. And for the first 3 weeks of the pill pack, you are taking pills that actively have both estrogen and progesterone in them. So in this one on the right that looks kind of like a calendar, right? These 3 weeks, these pills all have estrogen and progesterone in them. In this particular type of pill, they have slightly different doses. This is what's called a triphasic pill. That's not really been shown to make a big difference. It's just kind of style. But anyway, then the 4th week, you take placebo pills. So these are pills that actually have no active hormone in them whatsoever. So what happens then is that the progesterone levels, which have been, pretty normal, high-ish, right? The progesterone has been present in the bloodstream because you've been taking it in a pill every day. And then for a week, you take pills that have no progesterone in them. And so the progesterone level in your bloodstream falls. And that decrease in progesterone level causes the endometrium to break down and slough off as a period. So these pills were designed to make it so that people would still have a quote period every single month, but this period is kind of a fake period because it's not being caused by a corpus luteum making progesterone and trying to get ready for a pregnancy the way a typical cycle would. All right, so that's the pill. So that's one way to get these hormones into your body. Another way is to use a patch. So the patch has hormones in it that are then absorbed through the skin, which is pretty interesting. And the reason why that works is because these are steroid hormones. They're lipid molecules, and so they can actually absorb through the plasma membranes of your skin cells and get inside your body, which is super cool. So the patch is designed to be worn for a week at a time, and then you have to put a new one on, and then you go a 4th week. So you do that 3 weeks in a row. And then the 4th week, you don't wear a patch at all. Your progesterone levels fall, and you will have a quote period. So this is nice for people who find it difficult to remember to take a pill every single day. Some people don't like it because it's noticeable. As you can see, it's not exactly skin colored depending on your particular pigmentation. And some people find some skin irritation from it, but it's another way to get the same types of hormones into your body. Finally, the 3rd way to get combined hormonal contraceptives into your body is through the vaginal ring. So this is a little flexible plastic ring that is impregnated with these hormones. You insert it into the vagina and leave it there, kind of like you would a tampon, and it just slowly releases the hormone, which is absorbed through the stratified squamous epithelium that lines the inside of the vagina, and it gets into the bloodstream. So it's just another way to get the hormone into your bloodstream. And so usually it's used, you put it in, leave it in for 3 weeks, that standard 3 weeks on, 1 week off, and you have a period. One thing about the ring, most people find it doesn't cause any discomfort during sex or intercourse, but if it does, you can take it out for sex. The trick is you just have to remember to put it back in. You can't just fall asleep and go for, 8 hours without your ring in, because then your hormone levels are going to fall, right? And your birth control method could fail. Nice thing about CHCs is that they give you the option, if it's the pill or the ring form, to actually skip that quote period. So remember, that's kind of a fake period, and you don't actually have to have it. The uterus does not need to clean itself out once a month, not at all. And so you can just keep taking the active pills, or you can just keep your ring in for a whole month and then take it out and put a new one in on the same day. Now, not everybody's uterus will go along with this. Some people's uteri are like, we will not be denied, we will bleed, and they can start getting irregular bleeding and spotting. But for a lot of people, this is great. Why have a period if you don't need to? So again, you don't need to have a period every month if you are on birth control. Now, the reason why I say that is if you're not on birth control and you're not having a period every month, that means something's wonky with the system, right? And you can look at your menstrual cycle as almost like a vital sign for reproductive health. If you're not having periods every month, and it's not because you're on birth control, then something's going on. Something is not working optimally, and that should be checked out. If, however, you're using birth control in a way so that you don't have periods every month, that's totally fine. Okay, so a little distinction there. All right, how effective are CHCs? So if you're really good at taking your pill every day, they're really good. They're not perfect, right? So they're 99.7% effective if you take them perfectly, exactly how you're supposed to. The reality, of course, is that on average, most female-bodied people miss 4 or 5 pills per month. And so the typical use, so what we kind of see in real life, is that the effectiveness is only about 92%, meaning that 8% of people using birth control pills will get pregnant within a year. Okay, so 8% is a pretty decent failure rate. So really think about, are you a perfect user or are you a typical user, right? And so, it's interesting, about half of all unintentional pregnancies in the United States occur in people who are actually using birth control, but they forgot a few pills or started their pack late, or they weren't a perfect user. So something to be mindful of. Okay, so all of the combined hormonal contraceptives have risks and benefits, and so we're going to talk about them as a group because it's the same for all of them. So side effects can be common, especially in the first few weeks or occasionally the first couple of months, right? So some irregular bleeding or spotting, some nausea, most especially in the first week or so, some mood changes and breast tenderness, really common, usually go away if you just stay on the birth control. In some people, you can have worsened headaches and you can have mood changes that don't get better. That's not common, but it can happen. So it's one of the things we keep an eye out for. So those are the things that can be annoying but aren't particularly dangerous. Things that can be dangerous, one is it can increase your risk of blood clots. So your risk of getting a blood clot in your leg that could potentially travel up to your lung is about 1 in 2,500 if you're using a combined hormonal contraceptive. So it's really low, but it's not zero, right? There is a low risk, but a measurable increased risk of heart attack or stroke in people who are using combined hormonal contraceptives. It's less than 1 in 10,000. Your risk of death, actually, from being on birth control is 1 in 50,000. So it can happen, but it's rare. But I will contrast that with your risk of death from pregnancy and childbirth is 1 in 5,000, right? So that's 10 times higher. So pregnancy and childbirth is much riskier than taking birth control pills, so keep that in mind. So there are some people that have medical conditions in whom these risks are even higher. So there are some female-bodied people for whom we will say, you know what, it's just not safe for you, given your particular condition, to use a combined hormonal contraceptive. And so we'll recommend either a progesterone-only method or a non-hormonal method for those folks. There are some significant benefits that come along with combined hormonal contraceptives. And they include that if you take them for 5 years or longer, it actually reduces your risk of both ovarian cancer and endometrial, which would be uterine cancer, by 50%, right? So if you take birth control for 5 years or longer, your lifetime risk of both of those cancers gets halved, which is really cool. They also, because the period that you get on CHCs is not, quote, a real period, they tend to, in most people, significantly decrease menstrual cramping as well as the heaviness of their menstrual bleeding. So for people who have severe cramps or really heavy periods, this can be a godsend. This can be enormously helpful. They can decrease acne in some people, and they can also decrease PMS symptoms in a lot of folks, particularly if they do the extended cycling that we talked about, where you just skip periods entirely. So CHCs are highly effective if taken perfectly. They're quite effective even if taken according to typical use. They do have some side effects and risks, but they also have a lot of additional benefits aside from not getting pregnant. Now we're going to talk about progesterone-only methods. So these are a bit safer. So they're safe for people who have those medical conditions where we know estrogen is not safe for them. And so some of those conditions include people who have migraine headaches with an aura, not people with migraine headaches without aura, people with high blood pressure, a history of blood clots, or certain autoimmune diseases like lupus that can in some cases also increase your risk of blood clots. For those folks, we're not going to want to use an estrogen-containing contraceptive. So why is estrogen there anyway? The main reason why estrogen is in those CHCs is because it helps to control and regulate the bleeding. And so what happens if you take the estrogen piece away is that then you can get irregular bleeding or unpredictable bleeding or sometimes even absent bleeding altogether, which some people really like, some people it kind of weirds them out. So it really depends. So the big difference between progesterone only and CHCs is the CHCs, you will generally have regular, predictable menstrual bleeding, but with the progesterone only methods, that is not the case. So let's talk about the progesterone-only method. So the first one is the mini pill. So this is a pill, obviously, and it just has progesterone, no estrogen. And in fact, the progesterone dose in it is even lower than the dose that's in the CHCs. So this can be a good option for someone who has a lot of side effects with CHCs, right? Because it is a mini dose and it's progesterone only. So because it's a lower dose, the only way that this is preventing pregnancy is by thickening that cervical mucus. So the dose is not high enough to get negative feedback and suppress ovulation. So because of that, this pill, you really have to take it at the same time every single day. You can't be late. You can't miss a pill. There's no placebo week. You take an active pill every single day. And what we find is that some people continue to have regular periods as if nothing else is any different. Some people stop bleeding altogether. Some people get irregular bleeding. It really varies. So this is the one method where you have to be super, super, super good about taking your pill every single day on time. If that's not your cup of tea, or if you want something that's less hassle, you can get the shot. So the shot is a dose of progesterone given every 3 months, and it is super effective. It's one of the more effective methods available. It is a pretty high dose of progesterone, so it does change the cervical mucus, but it also causes negative feedback, and therefore you don't ovulate. There is, because of the higher dose, about a 10% risk of side effects like weight gain, headaches, or mood symptoms. And in most people, and I just realized it's not on the slide, I apologize. In most people, they will stop having their periods within a few months and certainly within the first 6 months of using Depo-Provera. So I once had a patient who used to do mountain climbing, like she would go out on these glaciers and travel all over the world and climb mountains for months at a time. So this was a great method for her. She didn't have to worry about bringing pads and tampons and all that kind of stuff along on the trek. So not having periods can be great. In terms of serious risks, we do know that if you use this method for several years, it can temporarily decrease bone density. Because of that negative feedback, you end up with a low estrogen state, and estrogen seems to be important for bone health. However, it is reversible. So we just ask people to go off of the method for a few years so their bones can recover, and then they can go back on it again if they want. Final progesterone-only method that we're going to talk about is the implant. So this is it's about the size of a matchstick. It's a little plastic rod that is impregnated with a progesterone, and we just numb up the skin of the arm and slide it under the skin of the upper arm. You can kind of see it between that woman's fingers there. It's hiding underneath her skin, and it's really, really effective. So what's interesting with this one is that it does inhibit ovulation, even though it doesn't actually cause negative feedback on the hypothalamus. Don't ask me how, we don't know, but it's really It really works. So this is actually the most effective form of birth control that is currently available. So 99.95% effective at preventing pregnancy, which is pretty amazing. And the other thing about it is once we insert it, it's good for 3 to 5 years. So it's what I call it a get it and forget it method. You don't have to remember to take a pill every day or put a patch on every week or a ring in every month or get a shot every 3 months. You just get it and you're good to go for 3 to 5 years. Also, when you want to try to get pregnant, or if you decide you don't like it, we can just really easily just take it right back out. So it's really rapidly reversible. So what's the big downside, right? And that is with the implant, it can cause irregular and unpredictable bleeding. And this is very difficult to predict. Some people stop bleeding altogether and they are thrilled. Some people continue to have regular periods, not much anything different. And then some people just develop this constant spotting or frequent bleeding, and they're kind of miserable. And that happens in about 30% of people who get this method, and I haven't been able to figure out a way to predict who that's going to be. So that's the number one reason why people end up discontinuing it, alas. But for those people who don't get that, they're really happy with this method, and it's highly effective. Right, so that's it for the progesterone-only methods. Now we're going to talk about IUDs, and IUD stands for Intrauterine Device. So this is something we actually place inside the uterus. We do it in the clinic as part of an office visit. It is quite uncomfortable, but it only takes about 10 or 15 minutes to do it. All right, so you can see we've got 2 different IUDs sitting in the palm of this person's hand here. They're these little T-shaped pieces of plastic. The ones used in the United States currently are a T-shaped, and we put it up through the cervix and into the uterus, and then it just sits there. And you can see the little strings that are here. Those hang outside the cervix so that when the person wants it removed, we can easily just grab the strings and pull it out. And the way the IUDs work are a couple. So one is that they thicken cervical mucus and they prevent the sperm from entering. And the other is that one of these has copper in it. So you see the one on the left, it looks like there's some copper wire wound around that plastic T. That is exactly what that is. And so why copper? So copper, interestingly, is very spermicidal. It's very toxic to sperm. It will kill them. So the copper IUD thickens your cervical mucus, and then if any sperm actually do get up through, it just zaps them. So that's the copper one. And then the other one that you see that looks like a Christmas one, the real life ones, that's a sample one. The real life ones are white. They're not red and green like that. Depending on the type, they come in a couple of different shapes and sizes, actually, not shapes. They can last anywhere from 3 to 7 years. They're really highly effective. And the nice thing about the hormonal ones that contain a progesterone is that they decrease your menstrual bleeding. And in fact, about 1/3 of women will stop having periods altogether. So this method of birth control has also become a really popular treatment for people with excessively heavy menstrual periods. Back, 20 years ago, we had to do hysterectomies in those people. Now we just put an IUD in and they're good. So that's awesome. But it does have hormone in it, way less than the pills do, but sometimes for some people it's enough to cause side effects. So it's nice that we have the copper IUD as an option that has no hormones in it. Now, the one disadvantage of the copper IUD is that it actually tends to make your periods heavier and longer. That's not a big problem for somebody who has a really light and short period, and now maybe it's like medium light and medium length. That's okay. But if you already have really heavy or painful menses periods, then the copper IUD is usually not a great choice. So like the implant, the IUD is also a get it and forget it method of contraception. Once it's placed, you're good to go for many, many years. You don't have to remember to do anything. And so what we've found is that over the last 10 to 20 years, with increasing use of both IUDs and implant, in part because They've become more available. They've become more accessible. Also, the Affordable Care Act made them more affordable. Unplanned pregnancy rates and abortion rates in this country are going down significantly because these methods are so effective, because there's no user error, right? There's no forgetting to take your pill. So one of my favorite methods to recommend to folks. So let's talk a little bit about the barrier methods. So primarily condoms, but also diaphragms, right? So the goal here is to place a mechanical barrier to prevent sperm from getting up into the female reproductive tract. So we've got your typical condom, also called a male condom, the internal condom, which is sometimes called the female condom, and the diaphragm, which is a little bit more complicated to use, so we're not going to talk about it today. But if you have questions, I'm happy to answer them. So a condom, right, it's a sleeve for the penis, right? And so it's going to catch the semen, it's going to catch the ejaculate, so that none of the sperm can get into the female reproductive tract. They're basically available in 3 different categories of materials. So latex has been around for a really long time. It's a great material. It's thin, it's stretchy, it's durable, it's strong. And so most condoms that you can find at the store are made out of latex, which is great. Not everybody loves latex. Some people actually have an allergy to it, and some people have a bit of a sensitivity to it, which is like an allergy, but not quite. And so there are some non-latex materials available. So the second category here are what we'll call the synthetics. These are actually plastics manufactured in a laboratory. Latex is derived from like the rubber tree, right? So that's a natural substance. Polyurethane was the initial latex-free condom, a plastic one, and now we have a new material called polyisoprene. This is the material used for the skin condoms, spelled S-K-Y-N, and they're pretty nice, actually. It's really thin, it's really stretchy, it's really strong. I have to say, I think that the skin condoms, the polyisoprene, may even outperform latex. So check those out if you haven't, and see what you think. And then finally, our last category would be the, quote, lambskin condoms. So it's sold as like natural lamb. They're really expensive, and they're not actually made of lambskin. They're actually made of, I think, the lining of intestines. So they're like sausage casings, and that's what they're made out of. And it's not very stretchy, and it smells kind of weird, and it feels cold. And most importantly, although the lambskin condoms will protect against pregnancy, they can block sperm. Because they're a natural biologic material, it has natural little pores in it through which lots of STIs can travel. So they will not protect you against HIV, for example. So that's really important to know. And they're expensive and they're kind of gross. So I just don't recommend them in general, but they're there if you want to try it. Okay, so this is just that information that I said, just for your reference later. Using a condom correctly is really important. So there's that extra credit assignment to show me on an inanimate object that you know how to appropriately use a condom. And this is a good video that goes through those steps. And here they are. So just really quickly, you want to wait till the penis is erect. You can't actually put a condom on a penis that is flaccid or not erect. It's just too soft. You won't be able to get the condom on. When you open the package, just tear it with your fingers. Don't use teeth. Don't use scissors. You might accidentally cut the condom. Then when you look at the condom, you have to figure out which way it unrolls, because it only unrolls one way, and if you try to put it on the other way, it's just not going to work. And then you also want to pinch the tip so that there's this little bit at the tip of the penis that is empty and can catch the semen, right? You need to have a place for the semen to go, and you don't want any air bubbles trapped inside there. Then you unroll the condom all the way down to the base of the penis, so the entire penis is covered. And a lot of people complain that condoms make sex less pleasurable. I get that. one of the things that can help is to put a little drop of lubricant on the glands of the penis before you put the condom on, and that can help increase sensation. Also, don't use 2 condoms at once. It seems like, oh, we'll just be extra safe, but that can actually generate friction between the 2 condoms that can increase the likelihood of condom breakage. So that is not recommended. After intercourse, you need to keep in mind that pretty much right away after ejaculation, the male-bodied partner will lose about 50% of their erection. So relatively quickly, that condom is going to start to be really loose on the penis. So you want to be aware of that, be proactive, right? And not hang around too long inside your partner. So then you want to hold the end of the condom against the base of the penis as you remove the penis from your partner to make sure that the condom doesn't slip off, right? So remove the condom, dispose of it in the garbage, clean off the penis before any further genital contact, right? Because there's some semen on the surface of the penis. All right, so I mentioned lubricant. So most condoms already have a little bit on them, but additional can be pleasurable or useful for both partners. There's lots of different types out there. As was mentioned earlier in class, ones that contain glycerin can be irritating to some people, so you might want to upgrade to a kind of more luxury brand lubricant, which are generally not available at your typical drugstores, but can be found online, absolutely. I also want to talk about spermicide. A lot of people think, oh, we'll use spermicide in addition to the condom, or we'll use a condom that has spermicide on it. And unfortunately, that hasn't been found to increase the effectiveness of protecting against pregnancy at all. And spermicides can actually be irritating to the partners and can increase your risk of getting STIs because they cause irritation of the tissues, which makes them more vulnerable to infections. So spermicides sound like a good idea, but we actually don't recommend them. So how good are condoms at preventing pregnancy? The answer is pretty good, actually. So 98% effectiveness with perfect use, but only 85% with typical use, right? So that's quite a bit lower than even typical use for birth control pills. And that's because people make some mistakes, right? So what are some of the common mistakes? Right? So one is, that's not on here that I should put on here, but one is waiting too long to put the condom on, right? So sometimes people will start having sex without a condom with the plan that then partway through, before orgasm and ejaculation occur, they're going to put the condom on, and then one thing leads to another and they never actually end up putting the condom on, right? So that's a problem. But assuming that you are using one, what can happen? So one is that it can break, okay? And so improper use is one of the main causes of that. So not squeezing the tip, and make sure you leave that reservoir there. Also, latex is a material that can break down over time, especially at extremes of temperature. So it's not recommended that you keep one in your wallet as a just-in-case condom, and the same condom has been in your wallet for like years, or has been sitting in the glove compartment of your car, right? The insides of our cars get really, really hot. They also get really, really cold. These things can weaken the latex over time. We know that if you handle condoms correctly and if you use them correctly, breakage is exceedingly rare. And we know this actually from the ladies who work at the Mustang Ranch. So this might be news to you, but there are municipalities in this country where prostitution is legal. And so the Mustang Ranch is one legal brothel. It's in Nevada, not in Las Vegas. You would think Las Vegas would have legal prostitution, but it doesn't. This is elsewhere in Nevada. And they use condoms, and they're professionals, and they're really good at it. And so there was a reproductive health specialist who spent a year living with them and learning about their experiences, and they're really good at using condoms, and their condoms never break. All right, the other problem is slippage, right? So if the condom is too large, right? So if you think, oh, I'm I'm going to buy the Magnum condoms, and if they're actually too large, or as mentioned earlier, if you wait too long to remove the penis and it has, lost its erection and the condom has gotten loose. So just about condom size, standard size condoms fit most people pretty well, but there are extra large sizes. Some people have really wide penises and a standard size condom is a little too tight and uncomfortable for them. So you just have to be careful to make sure that it's not too loose, right? You don't want to increase the risk of slippage. And then some people have relatively narrow penises or slim penises. And so you can also find snug fit condoms. Sometimes they're sold as condoms to kind of increase sensitivity because they're tighter. So you can look around and also find some that are a little bit more scaled for a narrower diameter penis. So you don't want the condom to be too loose. So how do college students do at using condoms? So this is an old graph, but it hasn't really changed very much. So I haven't bothered to update it with more recent data. So the National College Health Assessment is a survey of more than 30,000 college students that's done every year. And we ask people about a lot of different health behaviors, including sexual health. And so what we find here is of the respondents in this survey, only about a third, a little bit more than a third of college students reported using condoms always when they engaged in vaginal intercourse, right? So, a lot of people say never, and then we have, the kind of in between, rarely, sometimes, and most of the time. And so this is part of the reason why at Student Health Services we continue to do a good business in the diagnosis and treatment of chlamydia. All right, so I forgot this was in here. Okay, I thought we were going to talk about STIs next, but no. All right, so there's the internal condom you can also use. So this is placed vaginally, or if you're having anal sex, it's placed anally. And it's made of polyurethane. It works. It's meant to be single use and discarded when you're done with it. It's a bit more expensive and has a little bit more of a learning curve in terms of how to use it, but it can be a great option for some people. I will also tell you, though, don't use the internal and a male condom at the same time. Again, that friction issue actually increases the risk of breakage. All right, so how effective are the non-hormonal methods? So this chart shows you can see kind of up at the top here, if you're not using anything for birth control, about 85% of people will get pregnant within 1 year. Right? If you use spermicides alone, even if you use them perfectly, they're not awesome, right? So 18% failure, but that's still better than 85% failure rate, right? So if that's all you have and you're determined to go ahead and have sex anyway, then use it, right? Now withdrawal we didn't talk about. So withdrawal is removing the penis before ejaculation occurs, right? And ejaculating away from your partner. And if you use it perfectly, it's pretty darn good. The problem is it's really hard to do this perfectly. So when people try to use withdrawal or pulling out as a method, 27% of them end up getting pregnant within a year. So it's not highly recommended. But what I do want to point out to you here is that the condom is really highly effective if used perfectly and not terrible during perfect use, right? But not awesome. But again, it will also protect you against STIs, which I think the next slide, we're going to do a summary of birth control. Yep. And so you can go through this on your own. Let's go on to the next slide and start talking about STIs. Okay, so there are lots of different sexually transmitted infections. We're just going to talk about kind of the big four. So the first one is chlamydia. This is caused by a bacterium, and it's transmitted via body fluids, goopy bits. So you can't get chlamydia from just skin-to-skin contact, right? It has to be goopy bits. So insides of your body with other people's body fluids, right? And the tricky thing about chlamydia is that 50 to 70% of the time you can have this infection and not have any symptoms, like none. You have no idea. You feel fine. So you keep having sex and you keep having unprotected sex because you have no idea that you even have this. right? If you do have symptoms in female-bodied people, you can get some vaginal discharge or some pelvic pain. Male-bodied people can get some burning pain with urination or a little bit of discharge or pus coming out of the penis. And this is pretty common, right? So at any given moment in time, it's estimated that about 2% of college students actually have chlamydia. We just diagnosed 6 cases of it in the past month, so this November, which is down a bit from other years, but our visits have been down at Student Health because lots of people aren't coming in because of COVID. And in our county, there were over 155 cases total last year, and many of them were in Stout students. So the good news is that we can cure this. So the treatment for chlamydia is antibiotics. You just take a single dose of azithromycin and you abstain from sex for 7 days to give the antibiotic chance to work, and then you are all set. But it's really important that you and your partner take the medicine at the same time or close to it, and that you don't have sex for 7 days. Give it time to work so you don't pass it back and forth between each other. This can be 100% prevented by the use of condoms, right? Because then your goopy bits aren't getting on their goopy bits. So I highly recommend using condoms. That's chlamydia. Very tricky infection because you often don't know you have it, right? If you have pus dripping out of your penis, then you might be like, oh, I think I need to go get checked out, right? And then the chlamydia would be killed off because you would take your antibiotics. So it's very clever. It's sneaky. All right, the next one we're going to talk about is HPV, or human papillomavirus. Obviously, a viral infection is transmitted by either skin-to-skin contact, so this one you can get just from skin to skin, or mucous membrane contact, so goopy bits. And there's 2 different types of HPV. There are what are called the low-risk ones, and those cause genital warts, which you can see in the images below. The one on the left is part of a vulva. The one on the right is part of the shaft of a penis, and you can see those warts present there. Warts aren't dangerous. They're just, unsightly. People just don't like the look of them, and of course you can transmit them to other people. The high-risk subtypes of HPV can, over time, in some people, cause cancer. And so that is why the HPV vaccine was developed. And you are of a generation that most of you have actually had the HPV vaccine. So in the past, 60 to 80% of college students would get HPV in college. But now we hardly see it at all. It's really interesting. So if you do get it, how do we treat it? So if you have warts, we can freeze them with liquid nitrogen. We can treat them with acid. We can give you prescription cream. So there's things that we can do. But if you have that high-risk HPV, that kind that's associated with cancer over time, usually you still don't need any treatment. So 90% of young people who even get this high-risk type of HPV, their immune system will clear it within 3 years, and they will not have any problems from it. So what we do is in female-bodied people who are at risk of cancer of the cervix or cervical cancer from HPV, we do something called a pap smear starting at age 21 and then doing it every 3 years just to check and make sure that the cervix is doing fine. For HPV, condoms help a lot, especially in terms of preventing HPV from getting onto the cervix, right? Because the penis would be the HPV delivering device to get into the cervix. But of course, they're not going to help necessarily with warts if you have warts on the scrotum, right? The condom isn't going to cover that. So condoms help a lot against HPV, but not entirely against the wart-causing kinds. But the vaccine is available and it's highly effective. So if you haven't had it, I highly encourage you to call Student Health and arrange to get the vaccine. It's been amazing. We used to see abnormal pap smears all the time. Now it hardly ever happens. It's amazing. All right. Third, we're going to talk about herpes, right? So this is another virus, and it's transmitted by skin-to-skin contact, whether it's genital or oral, and of course oral contact. So you can get this from kissing somebody, you can get this from performing oral sex on somebody, or you can get it from somebody who performs oral sex on you. You can get it from intercourse, from genital to genital contact, right? And there's two different subtypes. So type 1 is the one that causes fever, blisters, and cold sores on the mouth, kind of like you see here in this image, when you get those little sores right near your lip there. And that is its preferred location. And more than, 50% of all adults in this country have this virus, the type 1 virus that causes fever, blisters on the lips like this. But if you have HSV1, which many adults do, you can give it to somebody on their genitals via oral sex. So just kind of keep that in mind. If you think you've got a cold sore or a fever blister coming, don't perform oral sex on your partner, okay? Because they can actually get it on their genitals. Type 2 only infects the genitals. It doesn't like the mouth. It only infects the genitals. So it's only transmitted by genital to genital contact, right? And again, so I just want to reiterate, HSV1 is super, super common, right? All kinds of people have it, right? So here's Paris Hilton, and she's got, let's see if you can see that right there. So she's got a little HSV1 right there. All right. Herpes usually has a standard progression of symptoms. So usually first you have a little tingling, you have a sense that something is coming, and then you get these little bumps that kind of look almost like little pimples, kind of, sort of. This is, we're looking at kind of the base of the penis, beginning of the scrotum on someone here, very, very tiny. And then those bumps turn into blisters. So here's some on the shaft of the penis. And then those blisters eventually kind of ulcerate or turn into open sores. And we can see some on the labia minora on this vulva here. You can see those sores. As you can imagine, this is painful. So herpes hurts. Pretty painful. So that's that standard kind of progression of symptoms that people get. And the good news is that there are medicines that can be helpful in treating outbreaks of herpes, as well as potentially preventing outbreaks. So if you're someone who gets this from time to time, right, and you haven't ever visited student health or your family doctor about it, it might be worth checking in with them, because you can get a medicine that can help shorten the duration and severity of outbreaks, or even prevent them from occurring. In terms of preventing, certainly condoms help if it's an area of the body that would be covered or protected by the condom. So still recommend condoms, and certainly don't perform oral sex on someone if you have a fever blister or think you're getting one. So finally, we're going to talk about HIV, which is human immunodeficiency virus. Viral infection transmitted by blood and body fluids, so it is sexually transmitted. It also, back before we knew how to test for it, it got transmitted by blood transfusions. We had a lot to learn, I tell you. And the tricky thing about this virus is that you often don't know you've been infected. Some people will feel sick when they initially get infected. They might feel like they have the flu or a cold. They might have a fever, sore throat, body aches, but they also might have no symptoms whatsoever. And what this virus does is it actually infects your immune cells. In fact, the same immune cells, called T cell lymphocytes, that are normally in charge of killing viruses, right? So it basically infiltrates, goes behind enemy lines, and sets up camp. And what happens is, over years, so in general about a decade, eventually it overpowers your immune system and your immune system collapses. So when that happens, you then have what we call AIDS, which stands for acquired immunodeficiency syndrome, right? Because acquired means it's something you caught. It's something that's happened over time. You weren't born with it. Immune deficiency, right? So your immune system is deficient. It's not working properly. And what happens then is you start getting really unusual and severe infections. And oftentimes it is those other infections that end up causing death in people who have HIV and AIDS. So this is just a little diagram kind of reminding you that viruses are not technically living organisms, so they have to enter the cell, as you can see in this first step here. So the HIV virus enters the cell, and then what it's going to do is, HIV is weird, it actually is going to get into your nucleus, and then when that cell replicates, it makes more cells that are infected with HIV because the HIV was in the nucleus. And then what the HIV virus does is uses the cell machinery to create more copies of itself, eventually exploding the cell and releasing tons of copies of the virus out into your bloodstream. Pesky thing. All right. The good news is that unlike when I was first a doctor more than 20 years ago, we now have really highly effective medications for HIV. And so most people who are HIV positive can now live a normal, healthy life and have a pretty normal life expectancy as long as they have access to and take their medication. This is really a miracle because when I was your age, actually I was living in New York City and the hospitals were full of people dying from AIDS. And now that doesn't happen anymore as long as somebody has access to medications. So one good thing about HIV is that condoms will absolutely prevent this, right? So if you always use condoms, you will not get HIV, right? As long as you're not also using IV drugs. Okay, so here's the summary on the STIs, those big four. There are others, as I mentioned, they are either less common or less significant. So I will leave you to review that because I've been talking for a long time. I hope this was useful, and yeah, there will be an extra credit assignment where you can answer some questions and earn extra credit. Thanks much.